Welcome, everyone. This is Jamie Flinchbaugh, host of People Solve Problems, and today we have a special guest, Steward. Skip, how you doing?
Doing great, Jamie, and glad to be here.
Glad to be able to talk with you again. Little brief introduction. You're the VP and Chief Improvement Officer, which you probably don't shorten a CIO very often because that confuses people. But at Baptist Memorial Healthcare Corporation, one of the I'll call it icons, right? But very, very strong presence in continuous improvement in healthcare. You're an award-winning and performance improvement leader who helps organizations improve quality, performance, financial outcomes, fostering cultures of continuous improvement. You're a Shingo faculty fellow and Shingo examiner. I've got your MBA, broad cross industry experience, going back to manufacturing. And you kind of have a practical, people-centered approach, which is, I think, why, those are words I like to use. So I think it's why we relate to leadership improvement and developing new leaders. So glad to be able to talk with you, your perspective, your work in healthcare, and all the things you bring to these conversations.
Glad to be here. Look forward to the conversation.
So let's start with prioritization. Healthcare, there's always 1,001 number one priorities. You have many constraints. You have changing conditions. You have a lot of stakeholders in the organization. How do you manage prioritization, both for yourself and your team, but also for the organization as a whole?
So one of the things that we are very active in, I brought to Baptist almost 13 years ago, is our strategic A3 deployment process. And I was mentored both in manufacturing, and he worked with us when I came to Baptist, an old friend, Pascal Dennis, Jamie, that I know you know well. And he had a great book called Getting the Right Things Done. And so we have had that process for almost 13 years. And that work at the very highest level has four themes: right care, right time, right place, and right cost. So if you were to go anywhere within Baptist, almost any of the 24,000 plus individuals could finish that sentence. We want the right care at the right time, at the right place, and the right cost. Now, under those themes, or what some people might call true north, we will have very specific areas that we're going to be focused on. And then that information will cascade down throughout the clinics, the hospitals. So, for example, under right time, which I happen to own that category, one of the areas that falls under that theme, not the only area, is length of stay. How long it takes for a patient to, once they're admitted, to get discharged. The government looks at that. The payers look at that. That's a really important issue. And so, that will then get cascaded as far as goals, as far as targets, as far as review, all the way down to the organization. At the highest level, we review that every single month. We track where we're at. We have different improvement endeavors. And so when we have people working on improving, we don't want to just be working on anything. We want to be working on those things that are going to help those goals that are aligned. So that's one example of how we focus at the high level. I do want to make this statement, though. At the micro level, sometimes people might pull us in on an issue, and it could be a social issue or a true technical issue. I find myself daily asking the question, so what are we trying to accomplish? Because good people with good intentions normally will start off with all the things they want to do. But I still have to understand, what is my anchor? What am I trying to accomplish? Because everything else is going to be in light of that. Everything's going to come to service of that. Whether I'm dealing with a people problem issue or whether I'm dealing with any kind of technical issue. An example of that would be last week, I was asked to come visit a clinic And there's these grandiose feelings of wanting to make it the clinic of the future, whatever that means. And and so I was trying to get a feel of the lay of the land, and just had a wonderful manager to meet with. And she was very enthusiastic, had all these great things that were seemed to be going on, and all these issues and problems that seemed to be occurring in her mind. But when I simply asked the question, Jamie, what is it you want to accomplish? That completely brought her to silence.
Mhm.
And she even openly said, I'm not sure. Well, I said, okay, well, let's explore that, because that's ultimately what we're going to have to serve.
Yeah, that's a beautifully simple question that gets to the heart. I love a good question. And I want to go back to strategic A3s because, well, I don't want to spend a lot of time talking about tools. We don't get to hear that term often. A lot of people, or many people, will bring up Hoshin Connery. I'm a big
Mhm.
fan of strategic A3s. What does that mean to you? Or what is a strategic A3?
Yeah. So, you know, the simple way to think about that is within that theme. So, for example, I used an example of length of stay that was in the theme of right time. Within that, on the left side, you're going to have some gap that you're trying to shut. You know, some where you're at now, where you want to be at, based on financial impact, based on how the government's going to rule against different claims, based on a lot of factors. But that first box in the left is what is the gap we're even trying to shut? The second box is what are the reflections, or what has even contributed to that? In other words, how did this gap even get formed? Why do you have that gap? What's contributed to there even being that gap? The third and final box on the left side, and I always coach people to only work on the left side and do not work on the right side. And I'll come back to that. But that third box is what are the set of hypotheses at a very high level? I try to limit them to no more than 5 because they would like to give me 20. But what are the hypotheses? If we did this, then this would occur that would help shut that gap. And I even try to nudge them to tell me how much of the gap it'll shut. So in other words, they may say, well, I don't know. Take a guess. In other words, I want to know, I'm trying to see your thinking. So with the Baptist management system, which is our improvement system, we give out these little blue brains. And on the bottom of the blue brain, it says, show me your thinking. This would be an example of that. I want to see your thinking on the left side. When we have a cycle throughout the year of, as we're getting ready for budgets, as we're starting to think about goals, as we want to have the goals done, we want to have everything done way before October 1, because October 1 is when our year starts. And we need to hit the year strong because we have major obstacles in that first quarter. They're called Christmas, Thanksgiving, and hunting season in the area where we live. And so we have to overcome that so that inertia doesn't kick in. And so I want only the left side at first. Let's just get the left side. And the reason I keep emphasizing that is it's human nature for people to want to go to the right side and talk about all the preconceived ideas and things that they want to implement. I don't even want to go there yet. I only want to know what is the gap, what's contributed to that gap, and what are the high level hypotheses. If we do this, then this would occur that would shut that gap. So then we'll get to the right side, and then we use that strategic A3 to turn it into what we call a status A3 for our monthly updates. And the status A3 is nothing more than the study and adjust for those that are familiar with the plan, do, study, adjust. So I know some people use the plan, do, check, act. We just call it plan, do, study, adjust. That's status A3 that gets reviewed every month, all the way down to the organization, is that study and adjust. But we want to cascade those A3s at the highest level all the way down to the entity levels so that we can see that work getting done.
Great. lots of clarity, lots of transparency in that, lots of ability to see the progress as things go, and keep people true to what those four key themes began with. Kind of again, what are we trying to accomplish at an enterprise level? You kind of hinted earlier about some of the working with people and getting teams together. Healthcare is particularly tricky because you have a lot of specialists, you have a lot of departments, you have a lot of just inherent fragmentation in the people and the work and the structure, which my mind would increase the need for that collaboration. How do you approach collaboration? How do you approach involvement? How do you get people across the organization involved together?
Yeah, let me first by say our Baptist management system, which is our improvement system, sits upon 11 guiding principles: people principles, process principles, and purpose principles. We're heavily influenced by the Shingo Institute. So we do a lot of things to promote the thinking of those principles. I say that at first because you notice I started off with people principles. And within the Baptist management system, 13, some people like to call them tools, I like to call them subsystems. We have two pieces that really promote those people principles. One is TWI job relations. We're heavy into that because TWI job relations, I like to explain to people, it's the best way I'm aware of to operationalize respect for every individual. And it's how do we deal with people problems? Until we have AI and bots running everything, we're going to have people. And are we going to show them respect? Are we going to respond to them in an objective way or an emotional way? And so TWI job relations is a huge piece of that. The second piece of that is practicing humble inquiry. And I say practicing because all of the elements of the Baptist management system are based on skill acquisition. So when I approach you, whether you be a renowned physician or whether you be someone on the janitorial staff, whether you be someone in Arkansas, Mississippi, or Tennessee, you're a unique individual. There is no one else like you. And so I need to approach it in that way. So humble inquiry would have me asking questions that I don't know the answer to. They're open-ended questions. And it isn't about me, it's about me asking you questions about your situation and what's going on. So that's a really important piece of it because I need to understand, what are you trying to accomplish? What is your situation? There's normally going to be, if I'm meeting you for the first time, someone that they'll want to vent about the situation. They need to be given that right to vent. Let them vent on that. They also need to know a little bit about me, not about my credentials, but can I personalize myself to them? Can I try to make a connection with them? Sometimes I'll take the jacket off. In the pre-COVID days when we wore ties back then. Thankfully, we got out of that. I would take the tie off, right? I'm going to do what I have to do to try to make a connection with you because I'm there to serve you. You're the customer, and I want to try to understand you, and I want you to feel like you're understood, and I want you to feel like you're seen. Does that answer that question, Jamie?
Yeah, absolutely. That's great, and I love those mix of tools, and it's interesting as you talk about TWI. So many people really just focus on the job instruction element of that, and you're really treating the whole set and really engaging with that respect for people component, which I don't think is quite as inclusive as it often is or should be. Let's talk about your coaching a little bit. And kind of already hinted at this with the brain with the show me your thinking. And I always used to use the analogy. People would bring me a finished A3, for example. I'm like, well, if you're already done, I could. It's like asking for parenting advice when your kids already moved out. Like
Right.
it's not really that helpful. But in the thinking, that's where the coaching can really flourish. But you have to coach experienced people with their MD. You coach people who are brand new to healthcare, entering on the front lines. How do you adjust your approach, your style, beyond taking the tie off?
Yeah.
But you so I think that's a good uh, I'll say entryway, right? That respect that you show somebody, meet them where they are. But how do you adjust your approach, your technique, your style for the various needs that you serve?
Yeah. So one of the elements of the Baptist management system is the improvement kata, coaching kata. We use that as a framework, kind of almost like a meta type of thinking as a framework for a lot of our work. Now, I would argue also, if you look at TWI, whether it be JI, JR, or JM, but specifically, let's talk JR, been around since the 40s, has a very similar framework. In kata, we say, what's the challenge? In TWI job relations, we say, what are we trying to achieve? In kata, we say, what's the current condition? In JR, we say, what are the facts? So we have that framework. We even have something we call the coaching workout. We have that framework by which is that meta framework of coaching, first of all. That being said, depending on the individual, depending on the situation, whether we're coaching you in in some kind of kata work or 8-step problem solving or an A3, or maybe we're just coaching you on our PDSA cycle record. We want to start with the socio side. You know, um, a mentor of mine, Dr. Edgar Schein, would always say, if people feel like there's more to lose than there is to gain, they'll be silent. And so when I walk up with this jacket and a dress shirt on, I'm already kind of 10 points behind.
Mhm.
I've got to earn the respect of those individuals and earn the right to even speak into their situation. And I don't really even know what's going on. So for me to ask humble inquiry questions, asking questions that I don't really know the answer to, shouldn't be that hard, even though it can be. Ed Schein would always talk about situational awareness. What is going on right now in the conversation and around me, right? So I need to be very much quick to listen, slow to speak, and try to understand what is going on. Ask those open-ended questions, because the thought there, Jamie, is that if I was coming up to you, you know something that I need to know. I just don't know what it is.
Mhm.
And I'm already being invited in. So do not take advantage of that and don't blow that. They're inviting me in on their situation, and so I'm trying to figure out what exactly is going on here. I don't want to come off as the quote unquote expert, because I'm not the expert in their field of discipline, whether that be surgery or pharmacy or wherever it may be. And so I really want to understand what's going on. I was in a hospital a week ago, and I saw someone jump in to kind of do the opposite of what I just said. And so I looked for the opportunity. I said, hey, time out for a second. And I went back to the people in the lab. I said, what does it look like a day in your world? Like I really didn't know anything about what they did. And afterwards, the individual that was with me said, I didn't know that they did all of those things. And I said, well, that was kind of the point. we need to understand their world, versus, us just jumping in and giving quote unquote solutions.
Oh, that's great. I just want to, I kind of add, we always hear different people's, mentors and authors and people they've read come up once in a while. I think this might be the first time Ed Schein has come up, and I don't know if that's true, but it's kind of a shame if it is, because everybody should at least read his work, and understand it. He's certainly contributes a lot. Um, so maybe a last question just to wrap up and kind of talk about healthcare a bit. I know you're really focused on Baptist Memorial and you're not trying to fix all of healthcare, but healthcare cost, access to service, so on is sort of constantly or at least perpetually on people's minds in the news. Um, Maybe can you give us some hope on how good fundamental continuous improvement practices can help solve the underlying healthcare concerns we have in this country?
Yeah, I think, first of all, I liked how you framed that up. The reality is, in my 34-year career, healthcare is the most complex socio-technical system that I've ever seen. And to quote one last time, Ed Schein would always say that it's not just a socio-technical, it's an open socio-technical system. And he would really emphasize that, and he would teach me about that. Um, and so that being said, it's a very complex. I don't believe there's any kind of simple, magic wand or, the next AI that's going to be sold to someone that's going to solve all the issues. But what I do believe is that a mindset can take one part of the process at a time, whether that be the social or technical or really just the whole thing. And for example, in our length of stay, we have been working on length of stay with a high concentration in the last 3 years. And it's not an overstatement to say we have seen improvement in our most complex hospitals and in such a way that we had a longtime 30-year veteran of our system said that I never thought in my lifetime I would see those hospitals, which is our largest ones, to be that good. And I think it's really because of the mindset. It isn't one simple thing. It's trying to figure out how do we get the patient to flow, which that's very difficult because if the information isn't flowing, the patient isn't flowing. And what are we trying to accomplish? But then there's all these little subsystems in healthcare, and you have to determine which ones are you going to focus on. And I like to equate it to there being a bunch of rocks and beaver dams in the stream, and you can't attack them all. And I get to where many times people want to attack the big things. Okay. But at some point, you've got to start going after some of the smaller boulders. And how are you going to remove them? And what is keeping that flow from occurring? And what mechanisms do you have set up to continuously improve? For example, when we first started this work, we were putting in what's known as an MDM, multidisciplinary meeting, which basically means you're looking at the progression of a patient. Are they moving forward? Are they progressing forward? And when we first started off this effort, I'd like to tell you this is an exaggeration, but the meeting took 2 hours. And I remember thinking, there's no hope of survival if we don't get it down. Well, today, not because of me, but because of the real people doing the real work in the hospitals, led by physicians, it's 15 minutes. Now, it is a productive 15 minutes, and it's rich in information. But Skip did not come up with those ideas. The real people, the real physicians, and the real nurses that do the real work every day took one step at a time with the right thinking, with that PDSA, running hypothesis thinking and experimenting. And so that should give us hope because when I've seen that occur, I mean, yes, has it radically reduced our length of stay, which has reduced our penalties? And yeah, it really has. But even more important than that, we all know that it's better for the patient to be out of the hospital, not in the hospital.
Mm-hmm.
So we're doing what's best for the patient. How do we move them? Because I remember what one hospital said, and I keep talking, Jamie, and I won't, but I love when this doctor said this, one of these other hospitals. He said, you know what the big aha for me this past year was, Skip? I said, no, I don't. He goes, I learned that it wasn't okay to wait.
That's
In other
great.
words, we became we became comfortable that the patient's just going to have to wait. Yeah, I know it's Friday and you could have been discharged. We'll get you discharged on Monday. But no, they could have been discharged on Friday.
Yeah.
Why do they have to stay the weekend?
Yeah.
And so those kind of personal stories that I'm involved with give me hope for other areas of healthcare. Is it very complex? Yes. Are there many challenges with the government and regulate? Of course there are. Is there one magic wand or thing that's going to fix everything? I don't. I believe it's a mindset that's going to fix things.
I love it. Well, Skip, thank you for sharing your perspective, your experiences, your stories, and I certainly wish you and the entire Baptist Memorial team all the success.
Thank you, Jamie.